Did you know that plantar fasciitis heel pain can be diagnosed and treated via telehealth very effectively? It all comes down to a proper assessment, and I'm going to show you today my favorite tests that we can do on our telehealth sessions that can help you get the right answers. One of the most common complaints with plantar fasciitis is being able to walk in your heels. So in a lot of our telehealth sessions, we actually have the person walk in their heels to figure out if there's actually local sensitivity there. You should be able to do about 10 to 20 steps easily, most people at least 20, and not have any symptoms at all. So if this is the case, it's a possibility it's not plantar fasciitis, but if you step just a couple times and it feels like there's a shock going through your heel, there's a higher possibility you have plantar fasciitis, but it has to be assessed with other orthopedics testing, range of motion testing, and other movement assessments to figure out exactly what's going on and why it keeps occurring. One simple assessment that we can use for plantar fasciitis in our telehealth sessions is side of foot walks, just like so. And so we look to see that you can actually shuffle around the room at least for about 30 seconds without having failure. And so observation is a big part, as well as history taking and other orthopedics testing. But what we can do here is we can use a little bit of the person's movements to assess what's going on with the foot and ankle. And so I like to do a single leg stance or a single leg stance or a squat pattern to demonstrate what's going on with the Achilles, which is a reflection of what's happening with the rest of the foot. So I'm going to do my best to simulate it here, but if you look at my left Achilles and then my right, one may look like it's bowed. So straight, bowed. And this is a reflection of, again, what's happening at the foot. Are the arches doing their job? Do they have windlass mechanism occurring, or is there stuff up the chain?